In memory of Ludovic Sery, 1980 to 2011, a vibrant soul whose life was forever altered by turbinate reduction and empty nose syndrome, ENS. This video serves as his poignant testimony, revealing his journey of discovery and resilience in the face of profound medical challenges. ENS is an iatrogenic disability, meaning it arises from medical error. In Ludovic Sery's case, it resulted from an ENT surgeon performing a bilateral turbinectomy. This surgery, intended to treat chronic rhinitis and recurrent nasal congestion, is often performed due to allergies, hormonal issues, or a deviated septum. Specialists often view resection of swollen turbinates as the solution. However, many surgeons act more like butchers than doctors, operating on the turbinates without fully understanding their role. They consider it a benign procedure, but it is far from that. ENT doctors who perform this surgery often minimize the importance of the turbinates, inadvertently condemning patients to disability by removing them. Only a few ENT specialists in France understand the turbinate's role and complexity. According to Dr. Stephen Hauser, our nose is our lungs. The turbinates are essential because they pressurize the air we breathe. Any alteration to these organs results in respiratory issues, as the patient may breathe in too much or too little air. The turbinates also heat, filter, and humidify the air, which is crucial for protecting against dust, cold, pollution, and microbes. Additionally, they contain airflow sensors that inform the brain about the amount of air entering the lungs. Removing or destroying them puts the body in a constant fight or flight mode. Some ENT specialists in France are beginning to understand their colleagues' mistakes and are starting to support their suffering patients. Some attempt to repair the damage with nasal implants, but no operation is perfect. Many testimonies indicate rejection of implants, and Ludovic did not recommend using them. Perhaps ear cartilage grafting might help, but there are not enough reliable testimonies to seriously advise it. Ludovic's story is a poignant one. He had a bilateral turbinectomy in 2002 and developed empty nose syndrome a few months later. His nose frequently became inflamed, unlike before the surgery. He regretted this so-called risk-free operation. His throat and mouth were constantly dry, he was always thirsty, and he had difficulty breathing. He first thought the anesthesia had weakened his heart, and that exercise might help. Despite his hopes, the situation worsened with headaches every evening, purulent rhinorrhea, bad odors, and more inflammation and dyspnea. He preferred his previous allergic rhinitis, which only troubled him 4 months a year, unlike this year-round nightmare, especially in winter. Ludovic visited the ENT doctor a year later to voice his concerns. The doctor dismissed him, attributing his issues to being too sensitive to temperature changes and delicate. Prescribed immune-boosting medications, the doctor insisted the surgery was successful and saw no reason for Ludovic's complaints. Later, his physician and another ENT doctor acknowledged his issues were surgery-related, but offered little beyond anti-inflammatories and saline nasal washes. Ludovic felt exhausted. His health deteriorated into severe depression, leading to prescriptions for anxiolytics, antidepressants, and sleeping pills. In 2005, Ludovic attempted suicide, leading to a month-long hospitalization and a second attempt by drowning, from which he survived. Mental and physical decline led to job redundancy in 2008 due to frequent absences. At home, he searched the web and discovered an article titled "Turbinectomy, Beware of Danger." Realizing the cause of his problems, Ludovic sought treatment for his open nose, opting for acrylic nasal implants in Paris. Initially, he experienced slight improvements like reduced dryness and fewer headaches and inflammations. Unfortunately, his body later rejected the plastic implants. Thousands worldwide suffer post-turbinate reduction and septoplasty, similar to Ludovic, often unaware of their surgeries linked to ongoing symptoms. Few doctors understand the condition, and some benefit from performing these procedures, staying quiet about complications to protect their practice. After 2 suicide attempts, Ludovic began therapy sessions determined to improve. In 2005, he found employment at a fruit factory but faced frequent sick leaves. In 2009, he was dismissed but quickly found work as a forklift operator, though he struggled with the demanding conditions and lasted only a month and a half. Now, let's hear Ludovic's mother share his story.
I still remember Ludovic's tense, pale face and his sad, bitter expression, filled with despair at not feeling as strong and joyful as others his age. He once confided in me, "You know, Mom, I'll never be able to pursue the job I want again." I tried to reassure him, saying things would improve, just as his father's back problems did. At that time, Ludovic took care of the house, diligently maintaining it despite his suffering. He repainted the doors, carefully choosing colors that brightened up our home. He hoped that staying busy with these tasks would help him feel better, at least a little. But unexpectedly, in July 2011, he took his own life, feeling he couldn't go on with the constant suffocation, dryness, and sleep problems. This surgeon had led him down this path by removing his respiratory organs, the turbinates, when all we sought was medication for his allergy-induced congestion. Ludovic was used as an experimental subject by this surgeon, who performed the procedure without fully understanding the devastating consequences it would have. It seemed the surgeon was more interested in testing his surgical techniques than in the long-term well-being of Ludovic. My son wanted the world to know he was a victim of an ENT crime, and he wished to prevent others from going down the same path he did. His adult life was shattered by his turbinectomy, and he never experienced happiness after his turbinates were resected. Our family and I suffered immensely. I'll never come to terms with this tragic loss and feel constant guilt for taking him to see that doctor. This is why I want to honor my dear son by sharing this video. I hope this testimony will serve as a warning and help prevent similar tragedies.
Before making this video, I called Ludovic's mother. It was a painful moment for both of us. For her, it was particularly excruciating as she is inconsolable. I understand how she feels because I have found myself in Ludovic's situation several times, even though I never achieved my goal of ending the suffering. I saw the pain and helplessness in my parents' eyes, similar to what I heard in the voice of Ludovic's mother. Ludovic was a good son. He was an active and sporty boy, born in Reunion Island. His mother wanted to complete this testimony to let us know how much her son loved life before his illness and how much he was appreciated by everyone. Ludovic did not commit suicide. He ended the immense suffering unjustly inflicted upon him by his surgeon who removed his nasal turbinates. Tragically, his story is not an isolated incident. Tens of thousands of people have had their lives devastated by similar operations. Ludovic's death is, unfortunately, not unique. Hundreds of individuals have lost their lives due to these procedures. It is our hope that by sharing Ludovic's story, we can raise awareness and prevent further tragedies.